Last section deals with terminology,
She didn't tell me how.
and I will give you some pointers on words to put in for some of these terms that'll help you remember them. So, anatomical position. Body erect, which means you're either standing up or you're laying down flat. Face forward, upper limbs at side with palms stretching outward or upward. So I know on your, I think it's your pretest or one of your questions, it said, if you're standing upside down, is your nose superior to your lips or something? It's a question something like that. So superior means above. My nose is above my mouth. It is superior to my mouth. And this is in anatomical position. So if I'm laying face down, if I'm upside down, sideways, it doesn't matter. On my body, my nose is superior to my mouth. So if it asks you if you're upside down, that doesn't matter. You're talking about anatomical body position. My nose is superior to my mouth. My eyes are superior to my nose. So superior means above. That's the word that you would insert. Inferior means below. My belly button is below my chin. It is inferior to my chin. We'll have, on your heart, you have a superior vena cava, which means it's where? Above. It's at the top. Inferior vena cava is going to be below the heart. Anterior means towards the front. So my nose is anterior to my ears. It's in front of my ears. Posterior or dorsal. A lot of times dorsal will also be used. Dorsal means towards the back. My spine is dorsal or posterior to my stomach or my abdomen. Median means closer to the middle. Lateral means to the side. So my nose is median to my ears. It's towards the middle, towards the center. Lateral means to the outside. So my arms are lateral to my face or something like that. So median, middle, lateral towards the side. Bilateral would be like your arms and legs. They are paired structures. You have one on each side. So bilateral will always be paired structures. Ipsilateral and contralateral. Ipsa means same side. So my right arm and my right leg are ipsilateral. They're on the same side. Contralateral, my right arm and my left arm are contralateral. They're on opposite sides. Proximal, distal, we'll use this a lot when we start talking about the skeleton. Proximal means closer to the point of attachment, and distal means further away from attachment. So if I look at my arm, I would say that my elbow is proximal to my wrist. It's closer to my point of attachment. My arm is attached at the shoulder. So my elbow is proximal. My wrist would be distal. It's further away. Superficial means towards the surface. So superficial veins are going to be close to like the surface of your skin. The layers in your skin will have superficial blood vessels. They're close to the surface. Peripheral can sometimes be used interchangeable with superficial. Peripheral also means outward or near the surface. And then the opposite is deep. So when we start looking at your muscles, your biceps is superficial. If I make an incision on your arm, your biceps is right there. You're going to see that muscle right away. If I peel away the biceps, there are muscles that are deep. So we will talk about deep muscles when we start getting into the different types of muscles. So those are important terms that we'll use. Here you can see top, bottom, front, back. If you start inserting some of those easy words, it makes it easy to understand. My knee is proximal to my toes. It's closer to the point of attachment than my toes are. Right side, all of this is going to be ipsilateral because it's on the same side. So some of the pictures can show that. Body sections, this is when we get into dissecting. So a sagittal section is going to divide something into right and half, or right and left. Mid-sagittal means that it's going to go right down the middle, where parasagittal isn't going to be right down the middle, it's going to be off to the side. And the diagram that comes up shows this better. Transverse is a horizontal cut. And then a frontal is going to divide, so you have a front and a back. So it would be like cutting something from top to bottom. So you have a front side and a back side. Here's the diagram that shows it really well. So transverse horizontal cut, you're going to look down at something. Mid-sagittal would be this blue because it's going right down the middle, the center of something. Parasagittal is going to be off to the side. It's not right down the middle. And then coronal is going to be this blue over here that cuts it in half so that there is a front and a back. Cadavers, when I took anatomy in high school and we went to the cadavers, the rules weren't the same. Anymore, they usually cover the hands and the face because they don't want the students to associate that person with anyone. I remember, and I was a junior, and we went to the cadavers, and my best friend and I are standing at the head of the cadaver, and they take the head and they had cut it right down. They had done like a mid-sagittal cut, and they just like plopped it open like right in front of us, and we were not prepared for that. It was interesting, and we were fine, but our starting center on our basketball team, our 6'6" guy, bloop, tipped over. It was funny. Here it's just showing some more cuts. So this would be completely transverse or horizontal. This would be coronal. It gives you a front and a back. I would call this oblique. It's actually off to the side. Also kind of transverse. It gives you a top and the bottom. And then body regions. This is more probably like in surgeries. So if I look at these, remember everything's backwards. So hypo means above. So here is my right hypochondriac region. So it's right and it's above. Inguinal, you'll see, kind of deals with the groin area. So this is right inguinal region. Right lateral to the side. And this is something that you will label and you'll just need to memorize. Umbilical deals with umbilical cord, belly button area. Umbilical's right in the middle. Epigastric deals with above again. Pubic region down in the middle. Left inguinal, left lateral, and left hypochondriac. Easier than that are just your four main quadrants. So right upper quadrant would be your liver, part of your intestines. Your gallbladder would be in your right upper quadrant. Right lower quadrant, intestines, appendix would be down here. Left upper quadrant would have your stomach in it. And left lower quadrant would have more intestines. Your left kidney would be over there. Your right kidney would be on the other side. And I'm not going to read through all of these. This is a labeling. These deal with specific body regions. Some of them are common. Mammary deals with breast. I'm pretty sure that makes sense to everybody. Abdominal deals with the abdominal region. That you've heard. But there's some, maybe acromial deals with the point of your shoulder. We'll use that when we talk about the skeleton. Mental is your chin. And the only thing I can think of is, and sometimes when people are thinking that's the only way I've always remembered it that way. But mental is chin. And sometimes you might question, who comes up with these terms, but this is what they are. Sternal deals with sternum. Buccal, there's a muscle in your chin called the buccinator, so that's something that will make sense as we go along. But these are just terms. You'll label them on your website, study them. I'm not going to read all of them to you. And that is the end of chapter 1. Yay.